Hi, I'm Dr. Bob Michelson. I'm one of the surgeons at Northwest Weight and Wellness Center in Everett, Washington, about 20 minutes north of Seattle. I want to talk to you about a disease that affects more than 1/3 of the United States population. That disease is obesity. Obesity can be a lifelong problem with many contributing causes. As you know, losing weight is challenging. Most people will try many diet and exercise programs in their lifetime. But sadly, only about 5% of people will be successful with getting the weight off and keeping it off.
Hi, I'm Dr. Alana Chalk, and I'm one of the surgeons at Northwest Weight and Wellness Center in Everett, Washington. Our center offers a comprehensive approach to weight loss and health management that improves your chances of being successful for the long haul. In the next few minutes, we will cover the basics of weight loss surgery. I will encourage you to call us for more information, and if you have questions, write them down and bring them with you to your consultation.
First, I want you to know a little bit about us. At Northwest Weight and Wellness Center, we focus exclusively on caring for people with obesity-related health conditions, and we've been doing that for over 15 years now. We are accredited by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program, and Dr. Chalk and I are both double board certified in both surgery and obesity medicine. This gives us additional tools to treat the many aspects of this disease, to help you reach your full potential.
It takes a team approach to help you reach your goals. We have assembled an expert team of highly trained, compassionate professionals to assist you every step of the way. Your contact with our team starts with your first phone call and continues as you meet our registered dietitians, therapists, doctors, nurses, and surgical team.
There are many causes for the obesity epidemic in the United States. Some of the causes are due to things we can change, and others are due to the hand we were dealt, like your genetics. Other contributing factors are your metabolism, the environment, your exercise and eating behaviors.
As a country, we began collecting obesity statistics in 1985. When we look at the levels of obesity nationally from 30 years ago to now, you can appreciate how quickly the obesity problem has grown in our country. These maps show the percentage of the adult population with a body mass index over 30.
Obesity now affects almost 40% of the United States population, which is greater than 93 million people. So know that you're not alone in your struggles. Obesity affects many aspects of your health. Almost every organ system in the body is harmed by obesity. Medical conditions associated with obesity are called comorbid conditions. Some of the more common comorbidities include high blood pressure, type 2 diabetes, sleep apnea, high cholesterol, fatty liver disease, and osteoarthritis. You may have been diagnosed with one or more of these. Obesity can also put you at risk for certain types of cancers, like breast cancer, colon cancer, uterine, esophageal, and pancreatic cancers. In short, obesity puts you at a higher risk of premature death when compared to someone without obesity.
Many people do not know that they may be a candidate for weight loss surgery. So who qualifies for bariatric surgery? We start by using your body mass index, or BMI. BMI is a calculation that puts your height and weight into an equation which produces your BMI. If you have a BMI greater than 40, you qualify for surgery. If your BMI is between 35 and 39.99, you will likely qualify for surgery if you have a comorbid condition or health problem related to obesity. If you don't qualify for surgery based on your BMI, we can still help you with our non-surgical weight loss program. Weight loss surgery is usually offered to persons with a BMI of 35 with comorbid conditions, or a BMI of 40 or greater with or without comorbid conditions. Although under certain circumstances, surgery is also offered to some individuals with a BMI starting at 30.
To understand how surgery can help, let's start by talking briefly about your digestive system and how it works. When you eat, food travels down your esophagus and enters the stomach. Food will begin filling your stomach before it starts to empty into the small intestine, which is where most of the digestion and absorption of nutrients takes place. We offer several surgical as well as non-surgical options to help with the treatment of obesity, and we'll discuss some of those weight loss options in this video.
The sleeve gastrectomy is a procedure that reduces the size of the stomach to about 20% of its current size. The larger portion of the stomach is then permanently removed. Food now flows into the smaller stomach, which is roughly the size and shape of a banana. The food moves into the small intestines the same way it does prior to surgery and is digested normally. This operation both reduces the size of your stomach and helps to decrease your hunger by hormonal changes that affect appetite and satiety.
Another surgical option is the Nwwc gastric bypass, or more commonly referred to as simply the gastric bypass. This operation is a little more complex. It also makes the stomach smaller, but it does so in a more or less horizontal manner. We now have a sealed off stomach, and we have to get the food out of it. So we go down to the intestine, and we cut the intestine in two. The part that's on the far side of that division gets brought up and attached to the stomach. The part that's on the near side gets spliced into intestine. So now we have food traveling down one limb, and digestive juices that are continuing to be produced in the stomach travel down another limb. And when the two finally meet, we begin the digestive process.
Another surgical option that is done less frequently is the biliopancreatic diversion with duodenal switch, or more commonly just the duodenal switch, or DS for short. This operation is the most complex of the procedures. This surgery combines the sleeve gastrectomy with a much longer intestinal bypass. Food is in contact with digestive enzymes for a very short period of time, increasing the risk of nutritional deficiencies. This procedure absolutely requires close follow-up for life, and patients will need to take extra supplements with this procedure.
If you'd like to make a consultation appointment, we will discuss which operation might suit you best based on your medical history, lifestyle, and other needs. We offer a comprehensive program that will help support you with the changes necessary to be successful.
We believe in following our patients not just for the short term around surgery, but for decades, as this helps optimize your continued success. Are you ready to get started?